Hello, my name is Rochi. This is a video for BSN 346. This video today will cover prenatal education, healthy pregnancy. Today I'll be talking about prenatal care, which is essential for ensuring both the health of mom and baby during this new journey. So let's talk about the frequency of prenatal visits and what to expect during each visit. So during the first trimester, which is weeks 1 to 12, you'll typically have your first prenatal appointment around 8 to 10 weeks of pregnancy. During the first trimester, you'll likely have one visit every 4 weeks. During this visit, your healthcare provider will confirm your pregnancy, usually perform a physical exam, or order initial labs. They'll also provide education on what to expect during the next coming months. During the second trimester, which is weeks 13 to 26, during the second trimester, appointments continue every 4 weeks. This is when you'll start to hear the baby's heartbeat, and you may have your first ultrasound, which is around 18 to 20 weeks. You'll also have a regular blood pressure checks, weight measurements, and fundal height measurements to track the baby's growth. So during the third trimester, which is weeks 27 to 40, in the final trimester, your visits will generally increase to every 2 weeks from week 28 to week 36, and then weekly until delivery. These appointments will include more frequent monitoring of your baby's growth, your blood pressure, and screening for conditions such as preeclampsia. Some labs and diagnostic procedures that will be done throughout your pregnancy. Several diagnostic tests and labs will help monitor your health and your baby's development. Here's what you can expect. So for the initial blood work, at your first prenatal visit, your provider will order blood tests to check for your blood type, Rh factor, complete blood count, CBC, and screen for any infections such as HIV, hepatitis B, or syphilis. The next test that they may also do will be ultrasounds. The first ultrasounds are usually done between weeks 18 to 20 to check your baby's anatomy and for screen for any birth defects. Some have an earlier ultrasound around 6 to 9 weeks to confirm the due date. The next test will be a glucose tolerance test, which is around 24 to 48 weeks. You'll have a glucose screening due to check for gestational diabetes. The next is a Group B strep test. This is done between the 35th and 37 weeks to check if you carry the group strep bacteria, which can be passed to your baby during delivery. If positive, you will be given antibiotics during labor to protect the baby. The next thing is nutrition during healthy pregnancy. So we have to be aware that a healthy diet is supporting your baby's development, and here are some guidelines. So the first guideline is key nutrients, and we want to ensure that you're getting plenty of folic acid, iron, calcium, and omega-3 fatty acids, because folic acids prevent birth defects, iron supplements increase blood production, and calcium strengthens your baby's developing bones. Also, omega-3 aids in brain development. Some supplements your provider may recommend a prenatal vitamin that contains at least 400 micrograms of folic acid, as well as other essential nutrients like vitamin D and iron. Food choices, we want to include a variety of fruits, vegetables, whole grains, lean proteins, like chicken, beans, and fish. We want to make sure those are all thoroughly cooked. the chicken and fish, as well as low-fat dairy. We want to avoid high mercury fish, such as swordfish, and limit caffeine intake. As far as exercise during pregnancy, staying active during pregnancy is important for both mother and baby. So some guidelines to follow would be recommended exercise. We want to aim for at least 150 minutes of moderate intensity exercise per week, such as walking, swimming, or prenatal yoga. These activities help improve circulation, reduce stress, and help prevent excess weight gain. Some exercises that we want to avoid during pregnancy are we want to avoid high-impact sports such as heavy lifting, any activities with a risk of falling, such as horseback riding. After the first trimester, we want to avoid exercises that require lying flat on your back because this can reduce blood flow to the baby. So as far as the expected weight gain during pregnancy, weight gain during pregnancy depends on your pre-pregnancy body mass index. So some guidelines for a healthy weight gain. So if you're underweight, if your BMI is less than 18.5, you should aim for a weight gain of about 28 to 40 pounds. For a normal weight individual, which is a BMI of 18.5 to 24.9, we want to have a recommended weight gain of about 25 to 35 pounds. For a person that's overweight, which is a BMI of 25 to 29.9, we want to aim for a healthy weight gain of about 15 to 25 pounds. And for a person that is obese, which is a BMI of greater than 30, we want a weight gain of only about 11 to 20 pounds, which is appropriate. So next we'll address some common complaints and relief methods that occur during pregnancy. So during pregnancy, moms may experience some discomfort. So some of the three common complaints and how to relieve them are: 1, nausea. This is usually common, especially in the first trimester. Eating small, frequent meals and staying hydrated can help. It's been documented that sometimes ginger supplements and vitamin B6 supplements may also provide relief. Another complaint during pregnancy is back pain. As the mother's belly grows, it can put extra strain on her back. So wearing supportive shoes, practicing good posture, and using a support belt can help. Prenatal yoga, stretching exercise are also beneficial. Also, lastly, the last usual complaint is heartburn. So during pregnancy, hormones relax the muscles of the digestive tract, causing acid reflux. We want to eat smaller meals. We want to avoid spicy or fatty foods. And also we want to elevate your head while sleeping to avoid any of these symptoms or help to reduce these symptoms. So the next following things we're going to be talking about are warning signs that you need to call your provider if any of these happen. It's important to know when to call your provider immediately. Here are some warning signs that we need to watch out for. So if you experience severe headache, this can indicate preeclampsia, a serious condition that affects blood pressure and can be harmful to both the mother and the baby. We will also, the next thing would be decreased fetal movement. If the mother notices that the baby is moving less than usual during, I believe, after 20 weeks, it may be a sign of fetal distress and you should contact your provider. The next is vaginal bleeding or fluid leakage. Any significant fluid or gush of fluid could indicate preterm labral or ruptured membranes, such as what you would call water breaking, and requires immediate attention. The mom and the baby's health are the top priorities. So by attending to the prenatal visits, following a healthy diet, staying active, watching warning signs. This can help ensure a safe pregnancy. So if ever mother has any questions, it's best to reach to her healthcare provider, and not hesitate to ask if there are any questions or concerns. And that is the end of my video. Thank you.